For all practicing pediatricians, 40% of patients who come for diagnosis or treatment usually have the symptoms of or suffer from a URTI, an upper respiratory tract infection. Therefore, the standard procedure for doing a routine check for all physicians and pediatricians is to examine the condition of the throat to try to identify the possible symptoms. For example, possible symptoms of tonsillitis, quinsy, and hemorrhagic streptococcal infection. With the traditional tools available and techniques, a doctor usually has to hold a pen light with one hand while using a tongue depressor with the other, and then they have to operate within a short time frame to try and get a glance at the conditions in the throat. This situation is usually worse for pediatricians because children won't usually sit still during an examination. This will sometimes make a doctor's diagnosis procedure a very unpleasant experience. Thus, our company designed and manufactures a whole new product, the Disposcope optical tongue depressor. It combines the standard features of a normal tongue depressor with a pen light and scope, which can wirelessly transmit an optical view of a designated area with ease, providing real-time display. Despite all the advancements in medical devices, the current diagnostic procedure still has the following downsides. 1. The patients and family members cannot see the conditions in the throat. 2. The doctor is only able to observe the upper throat area, but not further down. 3. The doctor has to use both of their hands while at the same time trying to do a visual inspection. 4. The available diagnostic time is very short, usually only a glance, which may not be long enough for a proper diagnosis. 5. The doctor has to use significant pressure to depress the tongue, which usually makes patients feel uncomfortable. We embedded a micro lens with 6 tiny LED lights attached to its outer edge. The lens is positioned at a downward viewing angle of 10 degrees. The tongue depressor is thin and lightweight. A doctor only needs to ask the patient to open their mouth and then press down on the tongue slightly. Our specially designed lens is able to enlarge the viewing area and also wirelessly transmit a real-time image to the monitor. While explaining their condition to patients, the doctor can view the image together with patients and can become more persuasive. This is a new and innovative way to enhance the communication between clinicians and patients, which traditional methods are unable to do. There is a huge difference between using the Disposcope optical tongue depressor and using a regular tongue depressor with a pen light held separately. Other main features. The video is transmitted wirelessly, making use of the device very convenient. The rechargeable battery inside the Disposcope optical tongue depressor can be used up for 3 hours when fully charged. 60% of the complete device can be inserted inside the mouth. 80% of the full length is waterproof and can be sterilized in a liquid. One-time use disposable cover avoids cross-contamination. This video demonstrates how to operate the Disposcope optical tongue depressor DSOTP. 1. Insert the DSOTP into the cover and turn on the power. 2. Insert and extend the covered DSOTP into the patient's mouth and throat area to obtain a clear video image on the monitor. 3. After use, withdraw the DSOTP and take off and dispose of the cover.